Ayan, so magandang tanghali po sa inyong lahat. We are now live at nagbabalik po tayo sa isang media forum para sa araw na ito, July 28, 2022. Ako po si Kim, ang inyong pong lingkod sa tanghaling ito. Kaya naman welcome sa ating media partners, viewers, and listeners na sumusubaybay po sa atin ngayon. So nais din po natin kilalanin ang ating guest experts na nandito ngayon na si Dr. John Wong, who is the founder and senior technical advisor of Epimetrics Incorporated, and Dr. Annalisa Ong Lim, professor and chief of the infectious and tropical disease in pediatrics of UP-PGH. And now to formally begin, nais po natin kilalanin si Dr. Beverly Lorraine Siho, the alternate spokesperson of the DOH and OIC Undersecretary of the Public Health Services Team to give the latest updates on health. Doc Bev, magandang tanghali po.
Magandang tanghali, Kim, at magandang tanghali din sa ating experts, kay Doc Anna and Dr. John, and sa ating mga media partners who are with us today. Sa ating lahat, narito po kami ngayong hapon para po magbigay ng updates tungkol po sa COVID-19 sa ating bansa. Gusto rin po namin gamitin ang pagkakataong ito para magbigay po ng ilang mga paalaala sa mga public health threats na meron po tayo ngayon. Meron po tayong guest, si Dr. John, na tutulungan po tayo sa pagbasa at pag-intindi ng mga numero at datos na madalas nating naririnig, at nandito rin po si Doc Anna para ipaliwanag po sa atin yung kahalagahan po ng booster doses. Tumungo na po tayo sa ating COVID-19 updates. Okay, so mula po July 21 hanggang July 27, yung ating last 7 days, nakapagtala po tayo ng 21,331 na bagong cases ng COVID-19. Patuloy ang pagtaas ng kaso na ngayon po ay tinatayang 3,047 cases per day, 3,047 cases per day ngayong linggo. Mas mataas ito by 32% compared to last week, at maihahalin tulad ito sa level ng cases natin noong last week of February. Narito po ang disaggregation ng mga kaso kada island group. Yung NCR po, yung blue line natin, ang may pinakamataas na daily moving average na nasa halos 1,100 cases per day. Sinundan naman ito ng rest of Luzon, ang red line, mayroong 700 cases per day. Ang plus areas, yung green line, Visayas, Peel line at Mindanao orange line, bagamat mabagal, nakikita nyo, nagpipick up na rin po yung mga kaso. Nationally, nananatili pa rin tayong nasa low risk classification na meron pong daily average attack rate na 2.43 cases per 100,000 population, with national and all regions all showing increases in cases in the recent 1 to 2 weeks. No? So, yun ang trend talaga natin. Pero lahat ng rehiyon ay nananatiling nasa low risk classification. Pero may 7 tayong rehiyon na nakapagtala ng average daily attack rates na at least ranging from 1.45 to 3.96 cases per 100,000 population. Tumaas din po ang ating positivity rate mula 12.5% last week to 14.8% this week. Katulad po ng rates natin noong February. Next slide, please. Bagamat po nakapagpakita tayo ng unti-unting pagtataas, nananatiling mas mababa, no? Sa 1,000 cases mula mid-March ang ating mga severe at critical admissions. Inuulit namin, no? Yung pagtaas ng kaso, hindi po sinasabayan, no, ng admissions natin. As of July 26, tinatayang 734 cases o 8.32% ng total admissions ay severe at critical. Nananatiling asymptomatic po ang nasa 16.49% ng total admissions at mild na nasa 40.97% ang karamihan ng ating mga na-ospital na kababayan. At kahit patuloy sa pagtaas ang ating mga kaso simula mid-May, mababa ang ating national admission. Ngunit nakakakita kayo dyan, no, sa nakabilog, may mabagal na pagtaas over the recent weeks. The total COVID-19 admissions showed an increase of about 12% or 757, while dedicated beds slightly decreased by 452 or 2% of beds from the previous week. Nito ring mga nakaraang araw, nakakita po tayo ng continued slow incline sa ating ICU admissions na tumaas ng 10% kumpara sa nakaraang linggo. At bagamat tumaas naman ng 2% na kasalukuyan na nasa 21% ang ating ICU utilization. Nananatili pa rin tayong low risk. No? So, ito ay dahil sa karamihan sa atin ay protektado sa bakuna, kaya naman hindi po sinasabayan ng hospital admission ang pagtaas ng ating kaso. Next slide please. Dumako naman po tayo sa mga additional subvariant cases. Batay ito sa huling sequencing results covering July 22 to July 26. Narito ang karagdagang cases ng ating BA.5 variant sa bansa. Meron po tayong 890 additional cases and BA.5 was detected in all regions except Region 12. So narito po ang ating breakdown. Karamihan po, 252 individuals sa Region 6, 232 sa NCR, 136 sa Calabarzon, 63 from CAR, 59 from Region 2, 46 from Region 3, 37 from Mimaropa, 29 from Region 1, 13 from Region 5, at tig-5 sa Region 7 at 9, at tig-1 sa Region 8, 10, 11, at Caraga, at huli 9 na ROFs. Nais namin linawin na ang hindi po ibig sabihin ito, mas marami sa region na na-mention namin. Ito lang ay dahil nakabatay po itong mga numero na to ayon sa bilang ng mga samples na nasubmit. So kung mas marami silang nasubmit na sample, pwede po na mas marami lang yung numero lumabas kasi mas marami po silang na-submit. 650 individuals ang fully vaccinated at 18 po ang partially vaccinated. Samantala, para po sa mga natitira, inaalam pa po natin ang vaccination status. Sa kasalukuyan, hindi pa po natin natukoy ang exposure ng mga individual at inaalam pa ang mga naging travel history ng mga ito. 823 na po ang tagged as recovered, 31 ang undergoing isolation habang inaalam pa ang outcome ng natitirang 36 individuals. At batay sa ating huling sequencing run sa kabuuan, meron na po tayong 1,997 na kasong BA.5 variant na na-detect sa bansa. Next slide please. Narito naman po ang 18 additional cases ng BA.4 variant sa bansa. 7 individuals from NCR, 6 from Region 5, 2 from CAR, at 1 each from Region 1, 2, and 4A. 13 na individuals ang fully vaccinated habang inaalam pa ang status ng natitirang 5. Sa kasalukuyan, di pa rin natukoy ang mga exposure nila. 17 individuals ang tagged as recovered habang nananatiling naka-isolate ang isa. Batay sa ating huling sequencing run sa kabuuan, meron tayong 71 cases ng BA.4 variant na na-detect sa bansa. Again, gusto naming linawin na may tig-isang BA.5 at BA.4 cases detected na inalis po sa ating tally dahil napag-alamang ang mga individual na ito ay duplicates lamang po ng mga naunang sample. So, meron naman po tayo, next slide please, 15 additional BA 2.12.1 cases sa ating na-detect, 5 from NCR, 4 from CAR, 3 from Region 4A, 1 each from Region 1 and Region 4B at isang ROF. 8 of them are fully vaccinated, isa pong partially vaccinated, and inaalam pa po ang status ng remaining 6. Hindi pa natukoy ang exposure ng mga individual at inaalam ang kanilang travel history. 14 out of 15 individuals ay already recovered at nasa isolation po yung natitirang isang kaso. So batay sa huling sequencing run, sa kabuuan, meron na tayong 154 na kaso ng BA.2.12.1 variant na na-detect sa ating bansa. Muli po, ipinapaalala po namin ang kailangan na protection natin. Siyempre, wear our best-fitting mask, isolate kung meron na agad sintomas, double up protection with our vaccines, primary series and boosters, at ensure po yung good ventilation or airflow. So BIDA upang patuloy tayong maging safe papunta sa new normal. So sa panahong ito, balik ko muna sa iyo, Kim, para po sa next speaker natin.
Okay, maraming salamat po, Dr. Bev. Ngayon naman po, tumungo tayo kay, nandito si Dr. John Wong, Founder at Senior Technical Advisor sa Epimetrics Incorporated and Associate Professor sa Ateneo School of Medicine and Public Health. At lecturer din sa Health Sciences Program ng Ateneo de Manila University upang ipaliwanag sa atin ang interpretation ng epi numbers. Dr. John Wong, good afternoon.
Good afternoon. Thank you, Kim. Can you show my slides? Next slide. Okay. So since the start of the pandemic, many groups have been making predictions about cases or hospitalizations or deaths about COVID. But sometimes we have to be critical about what these predictions are about. So I'd like to give a short introduction of how to look at these predictions and what questions to ask about the modelers, the people who are making these predictions. Next slide. So I'd like to answer three questions. So when people make predictions, how are these made? What types of mathematical models are they using? Second, how should these infectious disease models or IDMs be communicated? And third, for the public and for journalists, what questions should they ask when people make predictions? Next slide. Next slide. So for infectious disease predictions, all of them are based on this model. It's called the SIR, or SIR model. So basically what it does is it tries to classify or compartmentalize the population into three compartments. Those who are still susceptible to the infection, those who have been infected, and those who have been removed. So they can be removed by either recovering or dying. But those who recover, as we know now about COVID, can still become susceptible for reinfections. And also, fortunately for COVID, we have another compartment, which is the vaccinated, which is another way of removing people from the susceptible, or making them less susceptible. So in making predictions, what modelers do is they're trying to predict the number of people in these boxes. And they do this through a series of equations. Some of them based on data, some of them based on assumptions. So, for example, they'll need to determine what is the infectious rate of COVID, what is the recovery rate, and what is the death rate. We've also heard a lot of talk about R naught. R naught in turn is based on transmission rate, the contact rate, and the duration of infectiousness. As you can see, sometimes we have data on this, like for example, the number of cases, but sometimes we don't have the data. So for example, contact rate. We have no way to measure what is the frequency of contact of one person to another, or of a susceptible to an infectious person. So modelers have to make assumptions about this. For example, for recovery rate, again, recovery depends on the age of the population and the prevalence of comorbidity, and this varies from country to country, from region to region, and even from city to city. So, in short, models or predictions are based on data, some of which have biases of their own, and assumptions, which modelers have to make. Next slide. So the requirements of models are that first, their methods should be clear. and modelers should be transparent about how they what is the structure of their model, what the model looks like. For example, in the previous slide, I showed you a model with just 3 compartments, or 3 boxes. But 2 years later, the situation has become quite complicated. So you have people who have been infected, people who have been vaccinated with different variants, each with different transmissibility, vaccines with different effectiveness, and vaccine immunity has waned, and people have different vulnerabilities, because of their age and comorbidities. So one modeler in the States has said that in order to capture all of these complexities of the current pandemic, you actually need 30 compartments, not just 3. The second requirement is that data and assumptions are transparent. So experienced good modelers are transparent about what data they use, what are the biases in their data, and what assumptions did they make, and what is the basis of their assumptions. And third, the conclusions should be well-grounded. So if you draw any conclusions or make any recommendations as out of your modeling, they should be able to point back to their model and say, this is the part of the model that says that we should do this. So for example, if a modeler says we should all get vaccinated, but their model does not estimate what level of immunity of vaccination is protective, then they're making conclusions that were not grounded in their data or in their model. IDM teams are made up not just of mathematicians. You also need infectious disease specialists, epidemiologists, and public health practitioners in order to design your model and to make assumptions and to examine the data for validity. And the third, the data that's needed is not just based on virus variants, but the reason models are quite difficult to do is you have to account for social and behavioral factors of people that affect transmission, like the frequency of contact of people with each other and their motivations to mask or to get vaccinated. Next slide, please. So a famous statistician, George Box, said that all models are wrong, but some are useful. So the value of a model is not in the prediction itself. The value of the model is what it can tell policymakers and the public about how to prevent infection or prevent hospitalization or death. And this is what makes models useful. Next slide. So for example, this is an analysis of predictions that were made by 7 of the best modelers, best modeling groups in the world. So from left to right, these are the MIT group. Los Alamos is the energy laboratory of the US. Yu Yang is a data scientist based in MIT, Imperial College, University of Southern California, University of Washington, and UCLA. So the shades of color that you see there, these are the errors made by these modelers. So we can determine 2 things here, or these graphs tell us 2 things. First, all modelers, no matter how good they are, make mistakes, make errors. And the most experienced modelers will out front admit that their predictions have some uncertainty around it. The second lesson we learn from these graphs is that the farther out that you're predicting, the more errors that you will get. So in fact, more than 2 weeks out, if you try to make predictions more than 2 weeks out, your error becomes larger and larger. That's because it's very difficult to predict human behavior. And maybe a third lesson here, in the lower graph, that tells us that as the pandemic wore on, no, from September to 2020 to January 2021, the errors, prediction errors are actually getting bigger and bigger, no, kasi the situation is getting more and more complicated. So you need more and more complex models. Next slide. So what makes models useful, no? So for policymakers, no, it's not enough for them to know that, for example, in the next weeks or months, no, R naught will increase by 30% or decrease by 75%. No, what they want to know and what they need to know is what do they need to do? No, what policy options, no, do they have? Do they have, no, to achieve this decrease, no, in R naught? No, and which of these options should they do? No, vaccination, closure of borders, etc. No, and to what level? No, so the best use of a model is to be able to give policy options that, for example, you need to vaccinate up to 90%. Okay. Next slide. Next slide. Okay, so when modelers communicate their predictions, no, you have to listen very carefully, no, to what they say and how they say it. No, so here are some rules of thumb, no, when listening to modelers, no, or people who are trying to make predictions. No, be wary of absolute predictions. No, so if a modeler just gives you a single number, no, you should be suspicious about that. No, as we saw, no, in the previous graphs, no, there's a lot of uncertainty, no, around that number, no, especially long-term ones. No, so if they're trying to predict more than 2 weeks in advance, no, there's going to be a lot of error. No, and the reason for this is that infectious disease modeling is not like weather forecasting. No, in weather forecasting, no, the physics is very well understood, and we have hundreds of years of data, no, in order to make those predictions. The second reason is that the model itself can change the behavior of people. No? So, for example, when the DOH says that we may have 12,000 cases in the next month, no, people's behavior will change. No? For example, people will start to go get their boosters, no? Or they'll be more careful, no, in their public health behavior. No? So, and that changes, no, the trajectory of the pandemic. A second way, or a second thing you should listen for, or listen to when modelers speak, is listen if they acknowledge, or if they're honest about the uncertainty, around their estimates, and whether or not they discuss their limitations. These are traits or characteristics of scientific integrity, that they don't oversell, their model or their estimates. Next slide. So, for example, this is from the University of Washington. So, this is a good way of communicating their predictions. They give you their best estimate, which is a dotted line, but they also show you that there's a lot of uncertainty, around that model. There's a high end, which is almost twice, their point estimate, and their low end, which is actually half, of their best estimate. So this is a modeler being honest, about his or her uncertainty. Next slide. So again, if you look to the right side of the graph, they give their best estimate, which is the purple line. They also tell you what is the worst case scenario, the pink or red line above it. This is when there are no restrictions at all, no precautions. And then they tell you if people wear masks, you would actually have a lower line, which is the green line below it. So again, this is good communication of models. So these are the best models, the most valuable ones, because they're useful. Both the policymakers and the public know what they should do. The least useful ones are those that only give a single number. Next slide. So actually, there have been studies of how modelers have been communicating. And in a review of newspaper articles, no, they've seen that a lot of modelers actually are overconfident, no, in their estimate. No, they don't report their uncertainty, no, and their errors. No. For policymakers, no, the best modelers or the experienced modelers are those who communicate well, no, their assumptions and their uncertainties. Next slide. This graph just shows you the sources of error, no, of models, no, and it's based on how complex your model is, no. So looking at the red line, no, these are models where if you only have the basic elements, no, SIR, no, your errors are quite high, no. But the more complex your model, no, the more reflective it is of reality. No, for example, the 30 compartment model, no, recommended by the expert in the US, no, your errors go down. However, no, again, if you look at the blue line, the advantage of simple models is that you only need to make a few assumptions, no? So errors are few, no? But for complicated models, no, you need more data and more assumptions, no? So your errors pile up, no? They accumulate, no? So the best model is actually one that balances itself between simplicity, no, and complexity. Next slide. So for the public, no, and for media, no, what questions should you ask modelers, no, when they report or communicate with the public? Next slide. So first is, so if you're given a prediction, a number, no, you ask, how large is the uncertainty, no, the upper and lower bounds around your prediction? Okay, because this gives a better idea of how precise, no, the prediction is. No? Second, what are the sources of your data and what are their biases? No? So, for example, we know that cases now are underestimated, no, because of home-based testing, no, rapid antigen tests. No? So, what are the biases of the data that they're using? Third, no, what assumptions did you make, no, in computing your model, and what is the basis of your assumptions? No? So they're making assumptions, no, not based on data. No. So if they assume a certain number, for example, if they're saying that, let's say, cases are 30% underestimated or 60% underestimated, what is the basis for using that number? And then finally, and this is the most important question, no, based on your model, no, what should policymakers and the public do? No, the best use of models is to alter, no, the behavior of policymakers and the public. No, if it doesn't do that, no, and at the same time, no, it's wrong, no, because of the uncertainty, then there's no or little value to that model. Next slide. So this is just a study that shows that the best models are ensemble models, no, meaning, and this is something that the CDC does, no, it gathers or recruits multiple universities, no, and assembles their model into a single estimate, no, and that has proven to give the best predictions. Next slide. So I gave you a quote from George Box a while ago. No, actually, the second part of his quotation is that although models are wrong and some are useful, we have to keep in mind that models are just approximations of reality, no? And can never replace, no, or can never be correct, no, all the time. Thank you.
Thank you very much to Dr. John Wong for taking the time and sharing a very comprehensive overview of how to communicate epi numbers and what to look out for in models. So now, to proceed with our media forum, we bring back the floor to Dr. Beverly Ho to present the latest updates on vaccine coverage. Dr. Bev?
Thank you, Kim. Good afternoon once again. So we would like to just share with you some updates on our vaccination program. As of July 27, 2022, humigit 71.6 million na ng ating mga kababayang Pilipino ang pumili pong magpabakuna at maging protektado. Nasa humigit kumulang 9.7 million adolescents ages 12 to 17 at 4 million children age 5 to 11 ang bakunado at handa na pong mag-eskwela. Sa kabilang banda, halos 6.8 million naman ng ating mga nakakatanda ang may proteksyon laban sa COVID-19. Nasa more than 16 million individuals naman ng bilang ng mga kababayang bahagi ng pinaslakas dahil sila ay boosted na. Samantala, higit 1.2 million na ng ating mga kababayan ang nakakuha na ng kanilang second booster doses. Next slide, please. Magandang balita po dahil nung isang araw, kahapon, nailabas na po ang expansion ng ating emergency use authorization para sa COVID-19 vaccines para po ma-expand ito sa 50 years old and above, kay healthy or may comorbidities, at para naman po sa 18 to 49 years old na may comorbidities po. No? All of them can now receive their second booster shots 4 months after ng kanilang third additional or first booster shot. No? So that's 4 months after ng first booster shot. At pinadali na rin po natin ang proseso kasi hindi na po kailangan ng medical certificate sa vaccination site, kung hindi ang magsa-certify na po ay yung screening, no? Yung medical screener personnel na nandun po sa vaccination site. So nananawagan po kami muli sa lahat na pwede na po magpabakuna at magpabakuna na po kayo. Kasama natin ngayong hapon ang isa po sa ating mga experts na si Dr. Ana Ong Lim, Professor at Chief ng Infectious and Tropical Disease in Pediatrics sa UP-PGH upang ipaliwanag po sa atin ang kahalagahan ng booster doses. Doc Ana, over to you po.
Thank you, Bev, for allowing me to share some insights about boosters. Magandang hapon po sa ating lahat. And I'm sure we're very well aware of the current recommendations that have been shared by Director Bev or USEC Bev regarding boosters. So siguro what I'd like to do for the next few minutes is explore some questions about what, why, and how with reference to boosters. So since the time that vaccines were introduced for COVID-19, our goals have really been to provide the body with an opportunity to create its own protection without the dangers of actually getting the disease or even the infection. So although this diagram focuses on antibodies, alam natin na maraming iba't ibang components ang ating katawan na nagtutulong-tulong para gumawa ng depensa laban sa kahit na anong impeksyon kasama na ang COVID-19. What happens though over time is that those immune components decrease. And this is really a very good design for our body kasi bakit naman kailangan 100% ang alerto mo kung ang threat mo sa labas ay 5 or 10% lang. So bumababa talaga ang ating reaksyon, no? And sinasabing waning itong immunity na to. Pero pagka nagkaroon ulit ng pagkakataon na magkaroon ng exposure sa antigen, tataas ulit ang ating immune response. So whether that is for the antibodies or the different cellular components, and kung titignan natin itong part na ito, no, mas mahaba ang duration or lag time, dito sandaling-sandali lang mabilis na ang depensa. So inaasahan natin na pagka nagkaroon ng pagkakataon ng ating katawan na makasalubong yung mikrobyo, whether in the wild habang tayo kumikilos sa pang-araw-araw or when we are boosted again, magiging vigorous ulit ang ating immune response, no? Gagana siya ulit ng maigi para magkaroon ulit ng panibagong depensa. So kung tutuusin, very easy to understand the logic behind encouraging booster vaccinations. So bakit tayo nagkaroon ng a little bit of, I would say, I don't want to use hesitation, no? Pero mukhang yun ang magandang word na gamitin para dito sa sitwasyon na ito. So bakit hindi automatic, no? Na in-recommend natin na magkaroon na ng boosters kaagad. Marami kasing kailangan pang matutunan tungkol sa biology ng COVID-19 at hanggang ngayon kinikilala pa natin ng maigi itong kalaban natin. May mga kailangang masagot na tanong, no? Tulad ng sino ba dapat ang mabigyan ng booster? Dapat ba lahat? Bata, matanda, may sakit o wala? Or pwedeng yung mas matataas lang ang risk? Meron ding kailangang matutunan tungkol sa optimal timing ng third doses or ng subsequent boosters. Kasi paano natin malalaman kung saan natin siya dapat ilagay para makuha natin itong pagtaas ng proteksyon rather than sa pagbaba. Dahil nakikita rin natin to sa ibang mga bakuna. So ito yung mga datos na pinag-aaralan natin para masabi kung sino-sino ang dapat bigyan, kailan dapat ibigay, para maasahan natin itong magandang proteksyon for the boosters. So right now, what we have available in terms of data supports the current recommendations that individuals with highest risk, like seniors, immunocompromised, and healthcare workers, should already have a total of 4 doses. Ang ating mga general population from ages 12 and above ay dapat meron ng 3 dosis. At isinasama na rin natin sa ngayon yung mga 50 pataas at yung immunocompromised populations na adolescent, 18 and onwards, doon sa dapat tumanggap na ng 4 na dosis. Yung mga 5 years old down ay within the age group of 5 to 11 still continue to have a recommendation for 2 primary doses. So ano ba ang ating evidence para suportahan itong mga rekomendasyon na ito? This set of figures coming from Public Health England shows us that for people who are aged 16 and above or 80 and above, the longer the time frame after the second dose, lalong bumababa ang bisa ng bakuna against symptomatic infection at pati na rin against hospital admission, and finally, against death. So dito natin makikita na maganda ang evidence, no, for recommending a third dose for at-risk populations who belong to the senior age group, those who are noted to be or identified as at risk. May magandang review na published sa Lancet nito lamang Marso at tinignan nito ang over 13,000 papers para malaman kung gaano ba tumatagal ang bisa ng COVID-19 vaccine after receiving 2 doses. Dito sa pag-aaral na ito, sa review ng napakaraming mga papers that have been published, sinabi nila na maganda ang bisa laban sa severe disease. But after about 6 months, may konting pagbaba. Ang bisa laban sa infection and symptomatic disease decreased by 20 to 30 percentage points by 6 months. But again, the important point is that its protection against severe disease remained high. So babalikan ko dito yung objectives ng pagbabakuna. Ano ba gusto nating mangyari pag tayo'y nakatanggap ng bakuna? Hindi nga ba yung protection against severe and critical disease and risk of death? And with a primary series, this has proven to be very durable, and it is really those more minor, quote-unquote, objectives like infection or symptomatic disease that has waned or that has decreased more significantly. Now, nabago itong kwentong ito nung dumating ang bago nating kumakalat na variants. Itong Omicron and the subvariants that are now being found to circulate predominantly all over the world. And this newly circulating DOCs are really the reason why there's been very active exploration of additional doses, not just for the populations at risk, but also for all populations. Kasi kung iisipin naman natin, bakit nga naman natin naasahan na yung mga bakuna na unang pinanlaban or nakabase dun sa tinatawag na ancestral strains ng COVID ay magiging mabisa pa rin dito sa mga new and improved COVID viruses, no? So, of course, with that kind of mindset, madali nating maintindihan na, siguro nga, dapat nating isipin. Hindi lang 2, hindi lang 3, maaring 4 ang kailangan natin para mas maging maganda ang ating panlaban. So here we see, once again, coming from a population-based data set, no? This time coming from Israel, that they found daily cases to decrease very rapidly after they had their initial vaccination rollouts among their elderly population. Pero habang tumatagal na from the initial rollout, dumami na naman ang mga nagkasakit. Etong real-world data showing increasing rates of cases, severe disease, and death was really their reason to consider a booster rollout. At with that, nakita nila, wait lang, let me show the rest of that slide. So after they had the rollout, nakita na maganda na naman ulit ang proteksyon ng mga nabakunahan and their rates of disease as well as deaths decreased significantly. So, liban na lamang dito, napakarami pang mga evidences to support the initial recommendation to provide booster doses. And of course, we're all very familiar with the fact that 3 doses were recommended for coverage as early as December of last year. Now, sana naman ang galing yung rekomendasyon to consider a 4th dose. Again, we look to countries that implemented their vaccination programs much earlier than we did and observe what has been happening to their population. So ito na naman ang galing ulit sa Israel for their healthcare worker population. Nakita na yung mga pasyenteng nabigyan ng 4th dose represented by these blue and green lines were less likely to have disease compared to yung hindi nabigyan ng karagdagang dosis. So again, ang punto is that 4th doses have benefit for specific populations. Nung simula, ang ating HTAC ay nakapag-review ng evidence para ma-support ang pagbibigay ng 4th doses for our seniors, immunocompromised, and healthcare workers. And eventually, as of yesterday or 2 days ago, meron na rin tayong recommendations for 4th doses or second boosters for those who are 50 and above and those belonging to the 18 to 49 years old with comorbidities. So this is the press release dated July 26, detailing those emergency use authorizations. Siguro bago ko iwan yung usapin ng boosters, I'd also like to remind our viewers that ang mga 12 to 17-year-old individuals ay qualified na rin para makatanggap ng 3rd dose. And napatunayan, base sa mga datos, na pagka tayo ay lumampas na ng 5 buwan from our second dose belonging to 12 to 17 years, makakatulong na makatanggap na ng ikatlong dose para mabigyan ng mas magandang proteksyon. And this is the HTA guidance for adolescent boosters. Siguro, gusto ko lang magtapos by saying that the science of boosting really needs a lot of careful consideration. Although in general, madaling intindihin na over time, bababa ang ating immunity. Ang ating immune system, no, is really capable of protecting our bodies over a lot of threats. At hindi naman sa lahat ng pagkakataon inirekomenda, no, ang boosters. Kaya ganyan na lamang ang pag-iingat at pagre-review ng mga datos bago magkaroon ng rekomendasyon. Dapat ang pinagbabasihan, no, ng ating mga policies for boosting is really the science and the evolving information about this disease and what the vaccines can actually do. Although mahalaga na tandaan or i-consider ang mga logistical concerns and the available vaccine stocks, nandoon pa rin yung halaga na binibigay natin doon sa scientific basis for the recommendation for boosters. And right now, no, as a summary, pwede na tayong magbigay ng as much, or rather, the goal is to target 4 doses for our 50 and up, and also for those between 18 to 49 with immunocompromising conditions. And the target is 3 doses for those who belong to 12 and above in the general population. So with that, let me end my presentation and turn the floor back to Kim. Maraming salamat.
Maraming salamat po muli kay Dr. Ana Ong Lim for a very comprehensive presentation on the importance of boosters. Now we'll give the floor back to Dr. Beverly Ho for our final reminders and announcements from the Department of Health. Doc Bev?
Sorry, Kim. I'm just getting back to my deck. Alright, bago tayo magtungo po sa mga questions natin, meron po tayong reminders, no? Maging katuwang po natin sa pagpapatatag ng ating wall of immunity laban po sa COVID-19 virus at para maging mas up-to-date ang ating protection. Kaya kailangan po tayong magpa-booster. Nitong nakaraang Martes po, last Tuesday, official po natin nilunsad ng ating bagong kampanya, ang Pinas Lakas, no? Na naglalayong magpa-booster po ang ating populasyon. Nagsagawa po tayo ng malawakang bakunahan sa iba't ibang bahagi ng bansa sa tulong ng ating mga national government agencies, local government units, pribadong sektor, mga medical society, at iba't ibang lupon ng mga pamantasan at kolehiyo, civic and development sector, kasama rin ang ibang international na organization. Siyempre, katuwang natin dito ang aming mga partners, Centers for Health Development ng DOH. Hakbang po natin ito upang makamit ang ating target, which is 90% of our senior citizens A2 population, at mabigyan ng first booster ang 50% ng ating target population sa unang 100 taon po ng administrasyon na ito, which is October 8. Sa halip po ng malawakang bakunahan, ilalapit po natin ang mga bakuna sa mga areas at sa mga tao, no? Sa mga areas na may kailangan pang itaas ang coverage. So babakuna po tayo sa mga accessible na lugar gaya ng eskwelahan, palengke, sakayan o transport terminals, iba't ibang opisina, mga malls, mga pabrika, mga plazas, at mga lugar sambahan gaya po ng mga simbahan. Magkakaroon din po syempre ng home visits para sa mga mas nakakatandang population na nahihirapan po o wala pong mode of transportation tungo sa bakunahan. Ngayon po may banta ng mas transmissible na variant, mas kinakailangan po nating maging handa at protektado. Pinapaalala po namin ang unang booster 3 buwan matapos ang inyong second dose at 2 buwan naman kung single dose Janssen o Sputnik ang inyong nakuhang bakuna. Para naman sa mga magulang at legal guardian ng mga kabataang edad 12 to 17, maaari na rin po silang magpa-booster at least 28 days after completing their primary series, habang naman 5 months para sa general adolescent population. Vaccine immunity, sabi nga ni Doc Ana, wanes over time, ngunit maaari po tayong manatiling protektado by vaccination. Next slide, please. Bago po tayo tumungo sa ilan pa po naming mga paalaala, narito po ang tugon ng DOH sa nangyaring 7.3 magnitude earthquake kahapon, particular sa Abra na epicenter nito. Marami po sa ating mga kababayan nasa Hilaga, particular sa Abra, ang sinalanta ng 7.3 magnitude earthquake kahapon, July 27. Batay sa report ng ating CAR, CHD, Cordillera Administrative Region, CHD, 272 ang injured, kasama na rito ang 19 na dinala sa ospital. 4 naman ang nasawing palad dahil sa lindol, habang 4 pa ang patuloy na hinahanap. Hinggil sa ating health facilities, 53 ang reported na nagkaroon ng damages. 8 dito ay ospital, 28 ay rural health units, habang 18 ay barangay health stations. Kasalukuyan pong nasa Abra ang ating Assistant Secretary Nestor Santiago of our Field Implementation Coordination Team for Luzon at head din po ng ating NBOC Incident Manager. Nandoon siya upang alamin ang estado ng lugar at magpaabot po ng tulong. Nasa ground na po ang ating team, katuwang ang lokal na pamahalaan ng Abra. Nagpadala na rin po tayo ng ilang truck sa Abra na may dalang 20 tents, 200 cot beds, mga hygiene kit, gamot at iba pang supplies na kinakailangan. 2 medical teams na rin po ang deployed mula sa IPMRC at MMMMC upang maghatid ng health aid sa mga nasalanta, gayon din ang Abra Provincial Hospital na patuloy pong ina-assist ng ating DOH family. Makaasa po ang ating mga kababayan na handa pong tumugon ang DOH at tulungan po ang ating local government units sa napakahirap na panahon ngayon. Next slide, please. May dagdag pa rin po kaming mga paalala tungkol sa dengue. Bilang tumataas din ang kaso ng dengue sa bansa, we remind everyone ang ating 4S strategy upang hindi po magtagumpay ang lamok sa paglaganap ng dengue. First is search and destroy. Linisin ang inyong paligid, lalo na mga lugar kung saan maaaring mag-breed ang mga lamok, gaya ng bubong, kanal, lalagyan ng tubig. Pangalawa, secure self-protection, magpahid ng insect repellent at ugaliing maging malinis sa katawan. Pangatlo, seek early consultation. Kung nilalagnat at nagkaroon ng mga rashes, huwag mag-atubiling kumonsulta sa inyong doktor o health center. At panghuli, support fogging or spraying in hotspot areas upang tuluyang mapuksa ang lamok at ma-wipe out pati ang mga areas na hindi na po natin kayang maabot. Maliban sa dengue, narito pa ang ibang wild diseases o waterborne infectious diseases, influenza, leptospirosis at dengue na uso po ngayong tag-ulan. Una sa lahat, iwasang magtapon ng basura kung saan-saan maski na hindi tag-ulan. Makakatulong ito sa pananatili na malinis ang kapaligiran at maaaring bahayan po ng lamok at daga. Sa oras po ng pagbaha, iwasan ang paglusong sa baha. Kung hindi maiwasan, magsuot po ng bota. Huwag uminom ng marumi at kontaminadong tubig na hindi lamang tuwing may baha, kundi sa araw-araw po. Dahil maraming mga mikrobyo sa maruming tubig na makakasama sa ating katawan. Kung hindi siguradong malinis ito, pakuluan ng at least 3 minutes, 3 minuto bago inumin. Para rin sa mga kababayan nating binabaha ang lugar, laging ihanda ang inyong mga go bag na may mga damit na maaaring pamprotekta sakaling kailangang lumikas. At kung posible, magpabakuna rin laban sa flu or trangkaso. Iba ang maaga at sama-sama po natin kailangan pigilan ang wild diseases na meron at para ma-enjoy pa rin natin ang ating rainy season ng ligtas at malusog. So ito po ang summary ng aming mga paalaala. Sa kabila ng pagtaas ng kaso ng COVID, nananatiling nasa low risk ang bansa nationally. Kaya naman muling paalala ng DOH, maging protektado, best fitting mask, isolate when sick, double up with vaccines at ensure good airflow or BIDA. Para naman ma-achieve ang wall of immunity na ating inaatim, kailangan po sumama sa ating Pinas Lakas campaign para makuha po hindi lang ang primary series kundi ang first and second booster shots. Panghuli, huwag po kakalimutan, protektahan ang inyong sarili, ang inyong pamilya mula sa wild disease gamit ng ating 4S strategy at iba pang mga safety reminders. That concludes our presentation. Kim, our floor is now open for questions. Back to you.
Maraming salamat po ulit, Doc Bev. Apologies. Maraming salamat po ulit, Doc Bev, for the updates on health. Now we move on to our question and answer portion. And to our media partners who has additional questions later on, we'll try to accommodate them later on as we are kind of pressed for time. So we will now proceed with the questions collated in advance. For the first question, we have a question from Carolyn Bongkin of CNN Philippines. Bakit po pinayagan na ang second booster sa 18 to 49 na may comorbidity at 50 and above? Anong bakuna lamang po at pwede at ilang araw ang pagitan dapat sa first and second booster? We also have a similar question from Red Mendoza of the Manila Times. As guidelines of vaccination for the second dose have been issued for 50 and up, those 18 and 49 with comorbidities, do LGUs need to start these inoculations immediately once they have made the necessary preparations? I think this question is better referred to Dr. Anna. Doc Anna, your inputs for regarding the question of Carolyn and Red.
Yes, Kim. Siguro mas madali kung ipakita ko na lang yung slide para mas madaling maintindihan kasi ang dami na nating recommendations, medyo nakakalito. So, this is actually a summary coming from HTAC. Sorry, let me just show there. Etong boosters for healthcare, senior citizens, and immunocompromised are also pretty much the same as those for healthy 50 and above and immunocompromised 18 to 49. So ito yung ating susundin. Again, let me emphasize that the whole point of waiting for the HTAC recommendations is to make sure that we have enough evidence to support this recommendation for the different populations. And after a very thorough review of the data, nakita ng team ng HTAC na there's enough evidence na makikinabang talaga etong mga populations na nabigyan ng recommendation for a second booster. Tapos siguro ipakita ko na rin yung immunocompromised definition para naiintindihan din nating lahat. No? So this is the list based on the HTAC page. Thank you, Kim.
Thank you, Doc Anna. And I believe maybe within the day, we can provide also further details regarding the guidelines of the booster rollout for the 18 to 49 and 50 and above. Doc Bev, is there anything like you to add before we move on to the next question?
No, we're good.
All right. Now we move on to the next question, still from Carolyn Bongkin. May we know po if may pending application sa FDA for EUA or CPR of monkeypox vaccines? Sabi ni OIC Verheri in an interview last week, tinitignan makukuha ng donasyon ng smallpox vaccine and may update na ba dito? Meron na rin po ba tayong supply ng tecovirimat, cidofovir, and brincidofovir and VIGIV for treatments for monkeypox? Also a similar question from Dec Villanueva. As the monkeypox issue, if you can kindly give us an update on the plan to procure smallpox vaccines to be used as prevention for monkeypox in the country. Finally, another similar question from Jillian Ropero of ABS-CBN. Following the WHO's declaration of emergency for monkeypox, were there any additional monkeypox samples submitted to the DOH for testing? What are the results? Yusek? Yes, Yusek.
Thank you, Kim. Thanks for the question. Based on our guidelines, our practice guidelines that we have published late May, our main treatment modality is really supportive therapy. So the patients who may have monkeypox, your primary management natin is supportive. So we basically relieve their symptoms and make sure that they don't go into parang much worse condition. So basically that's our supportive therapy. So with that, we'd like to assure that we are in constant communication with our counterparts, particularly in the USAID, in terms of securing both the vaccines and the medicines. So the medicines will come in handy just in case the case actually is not a simple one. So, but for simple cases, supportive therapy is actually the recommendation. As to the mechanism, the EUA in the law, in the EO provides actually only for COVID-19 vaccines. So hindi natin magagamit yung EUA as a tool for other vaccines. So our current plan, kung CPR, medyo matagal po yan, no? Because it will take a certain process. So our route now is when we receive the vaccine, it will really be through CSP. So it's a compassionate special permit that FDA will be issuing for a limited amount of time. So that's really our route. So once we get the donations, we can use it ASAP. Kim?
Doc Bev. Now the next question is from Michael Deliso of ABS-CBN News. His question is, may we have an update on the dengue situation in the country? Also, Pasay City General Hospital has declared full capacity due to surge of non-COVID cases. Do we observe similar situations in other hospitals of the country? Yusek?
Thank you, Kim. For our dengue cases, as of our July 9, 2022, or Morbidity Week 27 data, we already have 73,909 dengue cases reported. This is cumulatively 96% higher compared to the reported cases during the same period last year, which is around 37,000 cases. Most of these cases were reported from Region 3, Region 7, and NCR. So in the recent period from June 12 to July 9, doon po yung pinakamarami. So around 18,000 of these cases were recorded. And 11 out of 17 regions already exceeded what we call the epidemic threshold the past 4 weeks. So we also have around 299 deaths reported all over the country as of this July date. So syempre hindi pa to kompleto kasi the reports continue to come in. As for healthcare utilization, let us all just recognize that because we have started parang regular operations already again of our hospitals, then hindi lang po yung COVID cases yung naggagamit ng hospital beds, but more importantly, there are other diseases and people are being admitted for these other disease conditions. So at the national level, 72% of hospital beds are actually being utilized for non-COVID cases. So our non-COVID healthcare utilization rate are high risk, or marami, puno siya, while for some regions, fewer regions, it's at moderate risk. However, for COVID cases, I have presented a while ago that we actually are in a better state. For COVID cases kasi mas limited naman na talaga yung na-admit, and our cases do not translate in the rapid increase in hospital occupancy due to COVID. Over, Kim.
Thank you, Doc Bev. Now we move on to the next question. And this next question, I believe several of our media partners are wondering on this. Now, this question is from Giselle Ricafort of DZRH News. A total of 3.6 million vaccines procured by the private sector ang nag-expire na raw noong July 27. Malaki ang panghihinayang ni dating Secretary Concepcion na ngayon lang daw pinalawak ang sakop ng second booster. The decision was made too late since it's already led by lots of millions of lost vaccines. What is the DOH comment on this? We have similar questions din po from Greg Gregorio. May we get DOH reaction on the recent statement of former Presidential Advisor Joey Concepcion regarding the expired vaccines? Also from Lay Alves of GMA News, same question, nasa 4.2 million vaccines daw ang nag-expire worth 5.1 billion pesos from the private sector. What is the DOH comment on this, Doc Bev?
Thank you, Kim. Maybe later on, our experts might also want to weigh in. I think from the DOH side, first and foremost, this is a vaccination program, and we want to assure the public that there's a process for making sure that the entire program uses vaccines that are safe. We abide by evidence when we expand indications or use of our vaccines. And so with that as a principle, it got us to where we are now, which is 71 million Filipinos vaccinated, able to open the economy, not having issues with healthcare utilization, hospital utilization because of this cooperation that we've had with each of the experts doing their roles, as well as the private sector supporting the government in the rollout. So I think we stick to that principle of working together, each one having their role, checks and balances are available. And that's why we are able to be confident to tell the public that this is a science-based, a very safe vaccination program that we're running. We recognize that there have been stocks that have expired, and efforts are ongoing now to work with our COVAX facility because they will be able to exchange the expiring vaccines of the national government. And so inquiries are being worked out whether they could do the same for the private sector vaccines. In addition, in our conversations with some private sector partners, they have raised that their employees are more interested now to get vaccinated. And so the national stockpile is available. We can give it to them. They can manage the administration, but we can give them the vaccines for free. So I think, and my final point there is that we still have a very low first booster coverage, 20% of those vaccinated. So ang dami pang pwedeng bakunahan. So it's not just about this policy that recently came out, but we can actually optimize the stocks to cover initially those for first booster. Pero ngayon, yung importante, we all have to work together, less sisihan, but actually working towards making sure that we reach the Pinaslakas targets.
Thank you, Doc Bev. Dr. Anna, before we move on to the next question, is there anything you'd like to support or add to that?
Yes, Kim, no? Talaga namang nakakalungkot na may bakunang masasayang dahil nag-expire. Kung tatandaan natin na nagpumahog tayo nung simula para magkaroon tayo ng bakuna, tapos ngayon nandito tayo sa punto na sasabihin natin, oy, ito na-expire nang hindi natin nagagamit. Sino ba naman ang hindi manghihinayang? Lalo na siguro kung naririnig natin na marami pang tao sa ibang bansa na wala man lang mahawakang bakuna and yet they're very eager to be vaccinated. No? So I think this is a realization that we're not just looking out for ourselves, we're looking out for everybody in the global community. Kasi hindi ito matatapos hindi matatapos ang pandemya hanggat hindi tayo lahat protektado. So, eto bang pag-expire ng mga bakuna, dahil ba yan ngayon lang in-approve ang second booster recommendation? I would beg to disagree kasi these are the same vaccines that were available for the first booster and even the primary series. So, hindi dahil sa ngayon lang in-approve ang second booster, kaya nagkaroon tayo ng um, expired doses. No? Kung hindi, dahil nagkaroon tayo ng gaps doon sa pagro-roll out or pagtanggap ng mga tao for their first dose, for the primary series, for their first booster, and of course, the second booster. No? So, keeping that in mind, no, should help us identify the real sources of the problem. Hindi dahil ngayon lang in-approve ang second booster, kaya nagkaroon ng expiration. Maraming iba't ibang dahilan, pwedeng operational, pwedeng management ng supply chain, pwedeng acceptance ng mga tao, pero maraming efficiencies na pwede pa tayong gawin rather than saying, ay kaya nag-expire kasi ngayon lang inaprubahan ang rekomendasyon for the second booster. I think it's not very productive to focus on that. I think it's more productive to identify the gaps that led to why this happened. And those are the reasons or those are the problems that we need to resolve.
Salamat, Doc Ana. Now, this next question po is still from Giselle Ricafort. Doc Bev, mapapaso na daw sa September ang declaration ng state of calamity sa bansa due to COVID-19. May recommendation na ba ang DOH kay President Marcos on this? Anong recommendations natin ng Health Department sa Pangulo? And napag-usapan na po ba ito? Doc Bev?
Yes, thanks, Kim. Yes, this has already been discussed by OIC Secretary Vergere in their meeting with the President. So we have noted that if we lift the state of calamity, there will be implications to the vaccination program, using the vaccines under EUA, emergency procurement, tax exemptions ng COVID commodities, IATF protocols, price control mechanisms, at mga benefits for HRH. No? So, syempre, ang iba po dito, no, legal issues siya. So, inatasan naman po yung mga ibang agencies na responsible na kasama po sa pag-aaral na ito. No? So, hindi lang po kami sa DOH yung gumagawa ng staff work, kundi pati po yung ibang ahensya ng gobyerno. No? Kasi this is not so much just declaring it, but a lot of legal implications. So, rest assured that we at the DOH have considered many options, put it forward, but we really need also the inputs of the other agencies who are in a better position to really advise on the legal aspect of it.
Thank you, Doc Bev. Now, this next question is from Jillian Ropero, but I think we've covered this very comprehensively earlier in our presentation regarding the earthquake and DOH's response to ABRA. So we move on to the next question from Gerard Naval of Malaya. His question is, under MC1 of the President, all OICs shall serve until July 31. What will be next for DOH under OIC Vergere after July 31? Doc Bev?
Wala pong magbabago sa amin. Tuloy-tuloy pa rin po yung trabaho namin at pagkamit ng mga targets, ng mga pagsunod at paggawa ng mga directives na kinakailangan. Kasi public health po, no, yung primary reason for being namin, and we have to continue doing that.
Maraming salamat, Doc Bev. And now, still from Gerard Naval of Malaya, his question on Representative Tevis's anti-ghosting bill. Is the DOH agreeing with him that ghosting causes mental, physical, and emotional exhaustion to the victim and thus should be considered an offense? And a follow-up question to that, does the DOH see any other adverse health effects to quote-unquote victims of ghosting? Doc Bev?
I think this has to be situated in the overall programs that we have on mental health. We will defer further discussion on this kasi this will require staff work. No? So ghosting is a very, I guess, cultural casual term, but in terms of how we address mental health issues, we always need to reflect it to technical terminologies. No? So medyo kailangan pag-aaral pa yung kailangan dito, pero we appreciate yung effort of Representative Teves to highlight the importance of mental health, lalo na sa mga kabataan natin ngayon. For which alam natin, no, in our hotline numbers, issues on relationships are top 3 reasons for why people or young people would actually call the hotline number, our helplines from the National Center for Mental Health. So this is very much appreciated, but we need to do more staff work on this.
Thank you, Doc Bev. Now, this next question is from Dec Villanueva of the Philippine Star. She says, in the post-SONA briefing, referring to Yusek Vergere, mentioned that the DOH will be more aggressive in using science-based, evidence-based approaches in dealing with emerging and re-emerging diseases, and that in fact the DOH already proposed a budget to DVM for that purpose. May we know how much this proposed budget is? Yusek?
Our current budget proposal, so there are many components to evidence-based approaches. So it will be difficult to give you a single number, but what is clear is that in our proposal for 2023, the evidence-based processes, meaning developing practice guidelines, engaging our expert groups, engaging academic institutions to help us work on, say, living practice guidelines that we have for COVID, but also for other diseases. They're all in our budget proposal. What else is in our budget proposal are budget to build public health laboratories. As of now, we have only 1 national public health laboratory and 6 subnational. No? And we hope to be able to expand this to 30 laboratories. So, syempre, there's a process year on year that we have to add budget into it. And then I guess finally, it's also important to note that we included budget for commodities, vaccines that are relevant, evidence-based. No? Kung walang ebidensya, we can't include it in our proposal. So I guess that's the best way we would be answering your question, Beck. Thank you.
Thank you, Doc Bev. And now this next question is still from Dec Villanueva. His question is, as the proposed creation of the Center for Disease Control, or CDC, in the country, will there be any duplication of function, if ever, given that the CDC usually has its own epidemiology and surveillance component, where in fact the DOH already has existing EBs, which you mentioned need to be strengthened? And how about the setting of public laboratories? Will this serve as a different function, and will this be independent of the CDCs? Doc Bev?
Maybe it's premature to talk about all the details of the CDC bill, but we've worked with the Office of Senator Pia Cayetano closely on a version last Senate, which basically when it will be refiled, we don't want the duplication also. So in that version of the bill, the EPI and surveillance function will really move to CDC, and you wouldn't have any more counterpart within the DOH. No? So that's everything. So there's a transition of function. Then syempre, all the necessary skills and investments will also need to be transferred. So ayaw po namin ng duplication din kasi mahirap po yun.
All right. Thank you, Doc Bev. And upon checking, I believe those are all the questions we have collated in advance. And for our live questions, I apologize to say for our media partners, we're pressed for time. And so for regarding live questions, we'll provide you with written responses to be released within the day. So we apologize again. And now to wrap up our media forum for today, may we ask our guest experts, maybe to start off, Dr. Ana, your final reminders and messages po sa ating mga tagapakinig.
Salamat, Kim, and maraming salamat sa DOH for the opportunity to share the very important message about boosters to the general public. Pinapaalala natin galing sa inyong mga healthcare professionals na kailangan na tayo ay up to date sa mga bakuna base sa ating kategorya. Kung tayo ay healthy adult, 50 and above, dapat we review our schedules kung qualified na ba tayo makatanggap ng ating ika-4 na dosis. At kung tayo naman ay nabibilang dun sa 18 to 49 na may comorbidities or immunocompromising conditions, ay nandoon na rin tayo sa grupo na pwede nang tumanggap ng ika-4 na dosis. Yun namang ating mga teenagers, dapat 3 dosis na ang natatanggap natin. At kung nasa 5 to 11 years old, sana natapos na rin ang kanilang mga primary series. Particularly for the pediatric age group, I'd like to reiterate, maganda tong pagkakataon na i-review yung ating status in preparation also for our back-to-school face-to-face classes. Para pagka nagkita-kita na lahat ng mga bata, mas mababa ang risk na magkahawaan. At the same time, I hope we don't forget the need also to be up to date for our routine immunizations. Kasi nga ayaw naman nating madagdagan pa yung problema ng pagkalat ng ibang vaccine-preventable diseases dahil lang nawala yung ating atensyon dito at parating nakatuon na lamang sa COVID. So ang dami nating kailangang alagaan para sa ating general health. Pero siguro ang maganda ngayon, all of these interventions are available. Kailangan lang natin magtungo sa ating mga centers at makipag-ugnayan sa ating mga public health sector para mabigyan tayo ng magandang guidance. Hindi nagkukulang sa availability ng mga bakuna. Kailangan lang natin bigyan ng konting panahon para mabigyan ng magandang proteksyon. Thank you.
Maraming salamat, Doc Ana. We'd also like to call on Dr. John Wong, but unfortunately, he has to leave. He has left due to another meeting. Now, Doc Bev, your final messages and reminders sa ating pong mga tagapakinig.
Thanks, Kim. Thank you to Doc Ana and Doc John for joining us today and to our media partners. I think we've said marami na kaming nasabi kanina in the past 1.5 hours. Just really encouraging everyone to get themselves vaccinated and convince their families, friends, and coworkers to do so in the soonest possible time to get up-to-date vaccination, because there are other health threats that we still need to face at kailangan parang isa-isa nating na-check na sa bawat isang health threat we are protected adequately. I think that's all I wanted to say. Thank you very much again to our media partners for your help in spreading accurate, timely information to the public to protect themselves. Back to you, Kim.
Ayan. So maraming salamat po sa ating media partners na sumusubaybay sa atin ngayon. On behalf of the DOH, muli po kami nagpapasalamat kay Dr. Ana Ong Lim and Dr. John Wong for taking the time to join us today and to present on the need for boosters and how to communicate EPI numbers. So muli po nagpapasalamat kami on behalf of the Department of Health. So dyan po nagtatapos ang ating media forum. Thank you, keep safe, and we'll see you po next week.